So, sorry?
Don't we do makeup first?
We've done the makeup.
Oh, okay.
So we found a difficult vein, and I'll show you how I would take some blood or identify the vein for putting in a cannula. So put a tourniquet on here, and take. I'm just going to have just a quick look around and just quickly find a decent vein that looks suitable. So I'm using a hockey stick. Like I said before, you can just use your normal point of care. They're just perfectly fine for these types of things. And we're just going to turn off the light for a sec, just so that you can see. Oh, there we go, straight away. So there's a vein there. You can tell it's a vein because we can wink it. So you've got to be careful, use plenty of gel, and when you put your probe on, put it on very lightly. So if I just go and put the probe on like that, then I can't see any vein. Well, actually I can find a deeper one there. In fact, just as an aside, see how there's a vein and an artery. I can wink the vein but not the artery. And you can see that if I put the colour on, artery is usually a bit more obvious than a vein. And if I squeeze the forearm, we might get a flush through the vein, just like that. Yeah, see a wee bit coming through there. Not too much. So obviously don't try and put something in that. So we'll go back to this our vein. See, I was putting too much pressure, it's hard to see. That's a nice vein. And we're just going to turn the light, no we're not, we won't turn the light back on. We'll trust that you can see with the, so all we're going to do is going to mark the skin. So I'm just going to go back, I'm just going to clean the skin off, then just put a small amount of gel on your probe, because you don't want to put too much gel on the skin because you can't get a marker, on there. And we'll just see if we can find it again. Oh, there it is. I can't feel that vein, by the way, but it looks pretty nice when you put so there's the vein. So then if we look on the skin, so I'm putting it in the middle of the screen and I'm marking the middle of the probe. So it's a transverse. So I put a little mark on each side, like that. And then, so you can see that. Yeah, so you can see the marks I've made on the skin. And then, of course, I could just connect those up like this. And the vein, should be under there. This is the other thing I can do is I can mark kind of the level where I had the probe, the center of the long part of the probe. And then you could do a sort of a cross along there. And that's kind of where we exactly looked. You can double check. You can probably leave the light on for this, but yeah. So so it's right there, right under the middle of the probe. So we know we're in the right place. The other thing to check is that, because veins often run at an angle, and if we put a bit more gel on now, so we could just put our needle straight in there and we should come across the vein. But we don't know if the vein's going that way, don't know if it's going that way, or maybe it's going straight. We haven't been able to tell that. So how you find that out, you can look at it in transverse. If you look at, what I'm going to do, if you look at the arm there, I'm just going to move the probe up and then down. If you watch on the screen, there's the vein. I'm moving the probe up and see it's going off the screen. And then I move the probe down, it's coming back in. So it's not that clear, is it? Yeah, and then I'm moving a probe down further and it's sort of heading off the screen down to the right. And so if you look on the skin, that means the vein is sort of going across that way. So we get a sense, okay, that's the way the vein's running. If you want to know that a bit more clearly, then what we can do is we just put the probe on the skin longitudinally and look at the vein. There's the vein there, right? And that's blood. See, I can squish it, right? Oh, there you go, that makes it a bit clearer. So that's the angle that the vein is running. If I turn my probe to directly sort of superior inferior, I actually go kind of off the vein a bit and I get it in transverse. So to get the length of the vein, I turn the probe sideways, look at the skin, and now I've got a nice picture on the screen, and then I do the same thing. I just mark the ends of the probe like that, and then just join the, yeah, so I probably have to, and then just join it like that. So it's not working very well because of the, anyway, you get the idea. The veins that are running through there. And we do one final check on the screen, just put the probe straight on there. Just make sure. And there's the vein. All right. And there's this, if you look at it on the skin, so the vein is right under there. When what often happens in these situations is that now we know where the vein is, we could, if we wanted to, we could put the, we'll take the blood under direct vision using an out-of-plane technique, or we can just trust that we know where it is. And often, even if you couldn't feel it before, now that you know exactly where it is, if I feel that now on the skin, just like you normally would palpate, I can feel it there now. So knowing where it is actually helps you. And then that's where I'm going to put my needle. I won't do that today, but that's how I find a vein if I want to cannulate or take a blood sample, and I don't want to, or I don't need to do it under direct vision. Thanks very much to everyone that helped.